the services get cut, if staff gets cut because of the impacts on the health system, then it's going to impact everybody.
Onvida Health is the only hospital system in Yuma capable of providing essential services to the community. CEO Robert Trenchel says 40 to 50% of their patients rely on Medicaid.
Medicaid is not, our experience is that is not Medicaid. Medicaid patients typically that come to us are either hardworking, they're lower socioeconomic, they need the resource for their basic health care.
More than $800 billion in proposed Medicaid cuts nationwide could force the hospital to make difficult decisions about where to reduce costs. That's because every patient is treated regardless of their ability to pay, in turn, leaving the hospital with uncompensated care.
We lose the most money in behavioral health. So do we close our behavioral health hospital?
Even essential services in the NICU could be at risk. About half of rural births are covered by Medicaid costs, but in Yuma, Nurse Carol Smith says that number is much higher.
And when you look at some place like the neonatal intensive care unit, that's an emergency unit. That's not something people can decide on and travel out of town for. So those are going to be massive impacts.
Trenchel says most rural hospitals would struggle to remain sustainable under the proposed cuts. Onvida's CEO recently traveled to Washington to speak to congressional leaders, warning that rural hospitals could be at risk of closure. Reporting live in Yuma, Alexandra Rangel, Arizona's Family.
Alex.